Dr. Winston Isaac, our facilitator for this evening, other esteemed members of the Rotary Club of St. Kitts, and gentlemen, good evening. On Saturday, July 15th, last Saturday, I attended the 4th annual free prostate screening drive. Yes, I'm a woman, but I attended. And this drive was conducted by the Rotary Club of St. Kitts in collaboration with Dr. Dwayne Thwaites, Island Medical Specialists, and A Time for Us Foundation at the Masonic Lodge building on Taylor's Range. I was pleased by the massive turnout of men. When I walked in and I saw the tent filled and the men were patiently waiting, it warmed my heart. I was told that approximately 347 men accessed care last Saturday, and that's impressive. I want to use this forum to convey congratulations to the Rotary Club and its partners in conducting another successful prostate screening drive. I want to big up the men for their positive response and support of this initiative. Please excuse my use of Jamaican parlance in so doing. Prostate cancer screening is an important public health intervention. Why do I say an important public health intervention? Well, chronic non-communicable diseases account for approximately 83% of all mortality or deaths in this federation. Yes, as much as 83%. And among these chronic non-communicable diseases, during the period 2009 to 2013, cancer accounted for most of the deaths, followed by strokes, complications of diabetes, and heart attack. Now, the most prevalent cancer affecting our men in the Federation during the period 2012 and 2015 was prostate cancer. Now, during this time period, we had approximately 69 newly diagnosed cases of prostate cancer in our males. The men were mostly affected between the age groups 60 and 79 years of age. So prostate cancer screening is a very critical intervention because finding this particular cancer in the early stages offers a better chance to cure this disease. It was Dr. Jairam Krishnan, a urologist at Cleveland Clinic in the United States, who once said, "Proper screening and early detection is the most important thing when dealing with prostate cancer." Prostate cancer is treatable and curable. The treatment, however, is individualized. The other presenters who will follow me will go into more detail with respect to describing the various treatment options. However, the treatment options may include surgical therapy, radiotherapy, hormonal therapy, and chemotherapy. And so I want to use this forum to underscore or to remind you that the oncology unit at the JNF General Hospital, which was opened in December 2016, have been receiving cancer patients for care. So in other words, cancer patients have been accessing care at the oncology unit at the JNF General Hospital between December and present. Now, between January of this year and June in particular, they have approximately 33 patients have accessed care at the oncology unit at the JNF Hospital. The types of cancers that have been treated there so far include breast cancer, colon cancer, cervical, and ovarian cancer. I want to underscore that the oncology unit at the JNF General Hospital has a well-developed protocol for the treatment of prostate cancer. I went there this morning just to check before I make this statement. I want to encourage our men to continue their annual medical checkups and prostate screening. It was Len Dawson who said, "Granted, prostate exams aren't the most enjoyable things in the world, but they only last about 10 seconds. It's well worth it. Just think of the possible consequences if you don't get it done." Now that's a statement I'm using to motivate those males who may be present or may be hearing me at this time to come out and get tested, and don't be afraid. Thank you.